Have you been experiencing hoarse voice for months? Then this video is for you. I'm going to tell you about 5 most common causes of chronic hoarseness. And I will also tell you the very first step you need to take on the way to recovery. Stick around and I'll be right back. Hi, I'm Katarina, speech-language pathologist from How to Improve Singing, and here on this channel I share practical tips about using your voice in a healthy way. So, if this is a topic that interests you, consider subscribing to this channel and hitting that bell notification icon so that you don't miss any of my videos. Okay, let's talk about chronic hoarseness. The term hoarseness generally describes abnormal voice changes. When your voice is hoarse, it means that you may sound breathy, raspy, strained, or you may have trouble speaking or singing loudly or in higher vocal ranges. You may have no pain, or it may be painful to talk. The changes can be mild or very severe. They can come and go or stay for the whole day. Acute hoarseness lasts less than 2 weeks. Chronic hoarseness lasts more than 2 weeks. So if you've had hoarse voice for months, it means you'll have chronic hoarseness and it's time to take action. There are many causes of hoarseness. Acute hoarseness that lasts less than 2 weeks is most frequently caused by an acute infection such as common cold or flu, and luckily this type of hoarseness is not serious and goes away after the infection subsides. But chronic hoarseness is a different story. Here are 5 most common causes of hoarse voice that last longer than 2 weeks. Cause number 1, vocal abuse, misuse, or overuse. Vocal abuse is any vocal behavior with high impact on the vocal folds. Examples of such behaviors are yelling, screaming, excessive coughing, or throat clearing. During these behaviors, your vocal folds bang against each other in a very abrupt and forceful way, which causes their damage and swelling. When you sing or speak with faulty vocal technique, you can also cause vocal fold swelling and hoarseness. Some people call it vocal misuse. For example, if you push your voice to increase loudness, if you engage muscles unnecessary for voice production, you are straining your voice beyond its normal limits. This is a very common scenario when talking or singing while sick. For example, you get a cold or flu, but you continue speaking or singing. In order to produce good quality voice, you need to exert more vocal effort and maybe push your voice a little bit more than normal. After the sickness goes away, you continue using this effortful way of voice production, which leads to more hoarseness and vocal fold swelling. That's how chronic hoarseness often develops. Another common scenario is using incorrect vocal technique when singing. If you get hoarse after or during singing, your body is telling you that you are not using your vocal instrument in a healthy way. It is a warning sign that should be taken seriously. I made a video on this topic and you can watch it by clicking this link. Now, let's say that you have good vocal technique, but you still get hoarse after speaking or singing. You may be overusing your vocal instrument. So, vocal overuse happens when vocal folds work more than they are conditioned to. This is a very typical problem for professional voice users such as singers, actors, presenters, salespeople, teachers, and especially music teachers, or anyone whose voice is essential in their daily jobs. In this case, you are not giving your voice a chance to recover properly. Here is the deal. Your vocal folds come together hundreds of times every single second when you produce voiced sounds. Every time the vocal folds collide, there is some loss of cells from the superficial layer of the vocal folds. Luckily for us, vocal folds have an amazing ability to repair themselves, but we need to give them the time. If you are overusing your voice, the vocal folds don't get a chance to restore, which results in vocal fold swelling and hoarseness. It is easy to eliminate these behaviors once you know what they are. However, sometimes people don't even know that they are misusing their voices. To help you uncover vocal behaviors that may be the cause of your hoarseness, I prepared a free checklist that you can get by clicking this link or a link below this video. Cause number 2, reflux. Acid reflux, GERD, LPRD, or laryngopharyngeal reflux are just a few names for a condition when acid fluids from the stomach flow backward into the esophagus and throat, which may cause irritation of the larynx. Acid reflux is a very common cause of chronic hoarseness. Very often, people are not even aware of having reflux because some types of reflux don't have obvious symptoms such as heartburn or indigestion. Sometimes the only symptom can be morning hoarseness, and that is because the backward flow of acid fluids is worse when lying down. So when you wake up after a good night's sleep, your vocal folds are irritated. Hoarseness then improves throughout the day and returns again after lying down or in the morning. Other symptoms of acid reflux can be the sensation of having a lump in the throat, so-called globus sensation, chronic throat clearing or coughing, or even difficulty swallowing. Cause number 3, allergies. How can allergies cause hoarseness? Allergens themselves can irritate the vocal folds and cause inflammation, swelling, and hoarseness. When you suffer from allergies, your nose is usually runny or stuffed up. Some of the secretion made in the nose can then drip down onto the vocal folds and cause more irritation in this way. Also, you may feel the need to clear your throat or cough often, which are behaviors that are definitely abusive to the vocal folds if they persist for a long time. And some allergy medication can also cause hoarseness. For example, antihistamines have a drying effect on the mucus in your nose, but also on the mucus covering the vocal fold. Dried up vocal folds can lead to hoarseness. Cause number 4, smoking. Smoking is an obvious cause of hoarseness. It's been well researched and documented that smoking causes changes on the vocal folds, for example, their thickening and even cancer. This cause should not be a surprise for anyone anymore. But in recent years, vaping is becoming more and more prominent, and while we don't know much about vaping and its effects on human body, I would encourage caution. Cause number 5, other causes. Less common causes of hoarseness may include growths on the vocal folds, including cancerous growths or benign lesions such as vocal nodules, polyps, or cysts. Also, neurological disorders, hormonal problems, and other chronic conditions may lead to hoarseness. Some of these may be very serious, and some of them can be treated easily. So, what should you do with chronic hoarseness of voice? As you can see, there are many different causes of hoarseness. Each of these causes is treated differently. So, the very first step in treating chronic hoarseness is establishing its cause. And this can be done only with the help of a professional, more specifically an ENT doctor. So, the first step in getting rid of your hoarse voice is making that phone call, to schedule a visit with your doctor who can diagnose the underlying causes. Once you know the real cause of your problem, a treatment plan can be developed. This can include improving vocal hygiene, reducing vocal use, eliminating vocal abuse, also voice therapy, surgery, medical management of acid reflux or allergies, and other underlying conditions. So, the bottom line is, if you have hoarse voice for months, talk to your doctor. Start looking for real solutions that will help you regain your voice back. It may take some time to deal with chronic hoarseness, so be patient. I hope you liked this video. If you did, give it thumbs up and check out my other videos right here below. I will see you in the next one.